A new study published by the Menopause Society found that women who suffer from both migraines and common menopausal symptoms could be at a higher risk for cardiovascular disease. Joining us now to discuss the link between menopause and heart disease is Dr. Jane Morgan, cardiologist at Piedmont Healthcare. Welcome.
Thank you, Mary.
Can you talk about why menopausal women have a higher risk of heart disease?
We're beginning to understand more and more and more about menopause, and part of the reason that we don't have data is that women are not really included in clinical trials. And so data that comes out of clinical trials is really geared towards men and then extrapolated for women. We also have in the past the Women's Health Initiative, a huge study 25 to 30 years ago that actually studied women and drew erroneous conclusions about menopause and menopausal hormone therapy. What we know is that women enjoy about a 50% risk of heart disease compared to men prior to menopause. And then after menopause, that risk actually equals that of men, and then later on actually surpasses men. And why is that? It's because we begin to lose estrogen during our perimenopausal years, which really can begin as early as your late 30s. And during those years, your estrogen levels drop, and estrogen is protective for the heart. Estrogen also decreases chronic inflammation in the body, and we know that inflammatory processes also increase and contribute to heart disease.
And what are other common symptoms of menopause that could lead to heart disease?
When we look at the symptoms, we begin to understand now that some of these symptoms for which, in the past maybe were ha-ha, people would laugh about them. Someone would suddenly become hot and begin to sweat and complain, these things called hot flashes that we now term hot flushes. But we know now that the duration and severity of those symptoms is also linked to heart disease. Additionally, as you go through perimenopause and approach menopause, your cholesterol levels increase. And cholesterol is also a risk factor for heart disease. And blood pressure also begins to increase as well. These are all independent risk factors for heart disease. When you think about the symptoms like insomnia and restlessness, difficulty sleeping, sleep duration and quality of sleep has a direct correlation with heart disease. So we now are beginning to understand that there are many symptoms of menopause that actually are risk factors for heart disease as well. And it's one of the reasons that a woman's risk of heart disease actually equals that of a man at menopause, whereas prior to only half that of a man.
And some experts have mixed feelings surrounding hormone replacement therapy for women going through menopause. How could hormone therapy help, and should they be part of it?
Such an excellent question, Mary. And not only is that a question for the public, even physicians are questioning it. The reason is we were not trained on menopausal hormone therapy because of the data that came out of the Women's Health Initiative. When that data was published and that it drew erroneous conclusions that hormone therapy increased the risk of breast cancer for women, all training stopped cold turkey for all physicians, including myself, in all training programs. And women for the last 25 to 30 years have really had no information. The Women's Health Initiative now has dialed back that information as we have begun to challenge it, including the types of women that were in these studies, many of them well beyond the menopause years, so the right group was not studied. And so as we begin to look at what this means, it appears, again, that estrogen and other types of menopausal hormone therapies are not only safe, but they also protect the woman's heart as she ages. And this is incredibly important because heart disease remains the #1 killer of women in this country.
And what are some ways women can stay healthy?
When we look at the health, especially as you go through menopause, bone loss, huge. Again, thinking about menopausal hormone therapy helps that, but also weight weight-bearing exercises, including walking. Walking is a weight-bearing exercise because the pull of gravity keeps you down, but things as well that you may not think about if you don't want to pick up weights, like Pilates, that uses the body itself to create weight bearing such that you can decrease bone resorption. These are all related to dropping estrogen levels, and we want to be able to protect ourselves with a healthy diet and also the types of exercise. We've got to be more specific as we age.
And doctor, if women are dealing with serious menopausal issues, should they be making an appointment with their cardiologist?
This is another excellent question. Absolutely. But here is the challenge. Cardiologists like myself still are on the precipice of learning, or shall I say, relearning this information. And so much of this really does lie within cardiology. But if you look for someone who has a menopausal hormone specialist, a specialist in this area, they have specifically studied it, and that is probably the best place to go now to have these discussions. But absolutely, it is moving increasingly into the discipline of cardiology as we understand that managing a woman during these perimenopausal and menopausal years is incredibly important to maintaining her heart health and keeping her risk of heart disease decreased as she goes through these years safely and in a healthy manner.
Dr. Jane Morgan, cardiologist at Piedmont Healthcare, thank you.
Thank you, Mary.